Oh, I just tried it. So meanwhile, I changed a bit of the title because I'm just struggling with how can I translate these terms into Hungarian, so into English from Hungarian. So let's just go with the child guidance clinic now, instead of what was in the abstract. Yes. So for an introduction, I would like to tell some things about the context. So I guess most of you heard about that in the turning of the 19th, 20th century, there was a growing concern for child welfare and protection from mistreatment, and there were development of government and non-governmental organizations who focused on the safeguarding of children, like UNICEF or WHO, and at the same time, there was also a European institutionalization of scientific expertise in childhood and psychological discourse of around childhood. And the Hungarian child guidance clinics are kind of product of these processes, and it can connect to the presentation, the previous presentation in many ways, but also it differs, and I think it's also really interesting because this story it's also start from state socialism in Hungary, but it's absolutely a different and much more fruitful way of how this state socialist era thought about child psychology. Yes, and some of my research objectives, it's the exploration of the history and also the current state of this institution in Hungary. That's why it's not clearly a historical research, because our research group is trying to step one further and thinking about the current situation from the perspective of the past, like how we get to the present point from the original tradition. Also, the aim is to get insight into psychological care, social policies, education, health, and well-being of children in Hungary, because this institution is a kind of like a center of all these different things. Also, this research tried to shed light on Eastern European history and methods of public psychological care, which is kind of interesting. And also, it's kind of examination of policy-making processes and what kind of things have effect on policy making, and also how policy making could affect history or culture. Just few words about my research group, because it's really important that it's not my own research, but I'm doing with different people, and maybe I just emphasize Melinda Kovai because she several times participated in ESHHS conferences. She's a sociologist, and she's also dealing with state socialist psychology from a historical and sociological standpoint. And also, this research is a part of my PhD research. It's a kind of case study because I try to deal with critical psychology, which has mainly Anglo-Saxon and Francophone literature these days. And I'm trying to figure out how we can apply these literatures to a state socialist situation, because there are many similarities, but there are many differences as well. And this case is actually a kind of difference which is sprung from the Eastern European specificities of Hungary and of this institution. A few words about methodology. I don't want to go really deep into it, but it's a qualitative research with its all advantages and disadvantages, because it's mainly based on interviews. We made interviews with professionals who worked in these child guidance clinics over the last 40 years. Also, social workers and other people who were the part of the team to see different perspectives. But also, it's right now at the moment it's like 15, 20 people, so it's not representative in a way how like psychological research have to be representative. Also, the way how I interpret this data is the IPA, interpretative phenomenological analysis, where I try to find main themes main structures in the narratives of the interviewees. I also use content analysis because the policies, the announcements, articles that I try to embed into the research. Yeah, that's about the method. So I'm just trying to start with the historical background and contextualization, and maybe that's going to be the biggest part. And at the moment, I don't know, but I'm starting it. So I just want to speak a bit about the emergence of these of child psychology in Hungary and of these clinics in Hungary. So the geopolitical position led to a diverse scientific paradigms and ideological backgrounds in Hungary because the state's role in institutional development of psychology increased after the communist takeover. It gave way for new experimental perspectives, institutional forms, and practices that emerged at time. So for me, what is really interesting in the psychology of that time, or the child psychology of that time, is that it has, on one hand, a really strong psychoanalytical legacy, which came from Budapest school, which came from the ideas of Sándor Ferenczy, who's actually really centralized the figure of the child in his psychoanalytical perspective, and also his pupils like Mihály Bálint, people like that really concentrated on the child as a figure in psychology and psychoanalysis. On the other hand, there is a really strong state socialist ideology, which had this idea that social mobility and equalization among classes could be bring about by psychology and education from the really early ages of children. And the third pattern in it, also the Western literature, which is a kind of tricky part because at that time it was really hard for professionals to get to Western literature, of course, because of the Iron Curtain, but there were different techniques and strategies of these people to somehow get these Western literatures. Of course, not all of them, but some, and that's why, for example, some methods are much more emphasized in Hungary still than others. So these three things are somehow mixed together and created this really interesting semi-peripheral style of Hungarian psychology. And I just want to note really shortly that it seems like the operation of psychology in Hungary at that time was a kind of fantastic way forward, but it's actually not true. There were waves in it because, for example, during the 50s, psychology was temporarily banned in the whole Soviet Union, and it was true for Hungary as well. And therefore, those psychologists who had leading positions and who did really interesting research on child psychology were banned from their work. But there will be another presentation next to me. Maybe it's more about that time. And after Stalin's death, the ban was gradually lifted, allowing psychology to regain its presence in the public sphere, but it also gave us, had a kind of effect on the identity or self-perception of psychologists in Hungary. So in the 60s, there was the first time when child guidance clinics were established, and there are also many details from the private life of those people who started to maintain these institutions because, for example, head of the culture ministry had a nurse who was also a part of this, it was not clinic at that time, but this child guidance movement, and this head of culture ministry, György Acél, anecdotically said, gave as a gift this possibility to maintain the child guidance clinics in Hungary. And it started from the capital, from Budapest. And there are three really important things which was a leading perspective of these institutions. One is that it mostly operated under the professional control of psychologists. And it was independent from the pedagogical discourse. So it doesn't mean that it was blind for pedagogy, but it was mainly a psychological institution for children. Another important pillar of it was the propagation of social mobility. So, as I told, psychology was viewed as a mean of social intervention and social mobility. Therefore, it was totally free. Also, at that time in Hungary, was not private care or was not official private care from that standpoint. But it was a really important thing that it was for free, and it was mainly for the working class. Even if the usage in reality was not mainly by the working class, but it's another chapter. And the third pillar is a multidisciplinary teamwork of these institutions. Because that was the idea, if we would like to understand these different classes, we need a multidisciplinary perspective. And therefore, in an average team in these centers, there was a pediatrician, pedagogues, psychologists, psychiatrists, special education teachers, social workers, family support service workers, and speech therapists. And they also created for each other informal training. So, for example, the centers was also really important to train the new generation of professionals, because they had some method-specific trainings which was not available in university studies at that time. Also, these teams made weekly case discussions, so all the team had some kind of connection for all the cases at that time. And they also created group therapies for parents, especially because they wanted to help them to understand what's going on with their children, and they wanted to help them to understand how they could help their children in their everyday life. And also another important step was the collaboration of these institutions with local institutions. So these centers were subsumed under municipalities, and they had connection with schools and social institutions and hospitals. So they actually really well know the local problems of people at the time. And this was the kind of golden age of child guidance clinics during the 70s and 80s. And the first big change came around in the 90s, the early 90s, when there was a regime change in Hungary. And there was a transition to democracy, but also this transition led to the total transformation of the institutional network and the infrastructure of these institutions in the early 90s. And of course, therefore, for this reason, there needed a financial rationalization. And it means that, for example, different institutions were merged or they were divided, and it happened somehow with the child guidance clinics as well. So the first problem was the teamwork, because there was a process of dissemination of different professions into independent institutions, which was a kind of loss of community culture and made much more harder the communication of different professions. And it made a much more bureaucratic work in their everyday operation. And another problem was the centralization of these independent institutions. It's easy to believe that during the state socialist era everything was centralized, but on the contrary, that was not the case with these child guidance clinics, because they had relative autonomy, because they had their teams, they had this kind of grassroots democracy where they created their own policies and then they channeled back them to the municipalities. But that was not true anymore, because with these many divided institutions, there needed one centralized one, and there is a long history from the 90s still nowadays how decentralized institutions change with the different governments, and I don't want to go deeply in that, but it's just absolutely not stable how these days this institution works. And it's also the bureaucracy, 5 minutes, these processes created longer waiting lists and also shortage of professionals because it was just not a really desirable profession anymore for new generations. And because I just have only 5 minutes, and it's absolutely not a problem because it's a history conference, and I guess I'm jump from the present. I just want to say that through this interpretative phenomenological analysis, I find out 4 main topics which is problematic from the 90s until nowadays, which is the marginalization of psychotherapy, as it was told that it was a main centralized thing in the operation of Childcare clinics. But these days, because of the long waiting list, the shortage of professionals, and inadequate infrastructure, they have no time for real in-depth psychotherapy. They can only just create diagnoses, and many of my interviewees says that it's like a diagnostic factory these days. Another problem is the centralization that I already told you. The third one is the professional disposition, and I also said some things about that during the last 20 years, the salaries became less and less, and also because those psychologists who work in these institutions are actually under the educational paradigm or educational part of the bureaucracy in Hungary, and not the clinical or healthcare one. And therefore, there is a huge difference in salary, for example, which is a kind of big problem, because these days young professionals have to pay for their specialized trainings, and they cannot really afford to work in a place where they cannot earn enough money to finance their own training. Therefore, there are less and less professionals in these institutions, and from the perspective of my PhD, the biggest problem is the limitation of access. So as I told you earlier, the idea was the social mobility, and therefore it was a free care for all people or children and families. But these days, the problems that comes from the shortage of professionals in the public healthcare system try to find solution on the market, the free market. And many children from middle class or upper middle class can get this private care, private help, but not from the lower classes. So it's actually a totally opposite of the original idea. And so it's a kind of, it's not just not help, but actually making stigmatization, because after they create this diagnosis, but they cannot give a proper therapy for some children, they cannot, or it's influencing their position in public education. And it just puts kids into specific boxes, like according to their abilities, which is absolutely not clear if it's organic or non-organic. Yeah, so that's what I wanted to say, and just as a conclusion, so I think the interdisciplinary investigation of this issue is really vital, because it's not only a psychological problem, and it's not only a sociological problem or historical problem, but it's intertwined. And as you saw, all these 4 main topics are really, really intertwined with each other. Yes, and that's it. Yes, thank you so much.
Actually, these centers sound a lot like the child guidance clinics that were set up in the United States during the 1930s in terms of teamwork of psychologists and clinicians and social workers, et cetera. My question is specifically what kind of problems, I assume that these centers are dealing with problems, problematic children. I mean, they have some kind of problems, maybe they're not going to school or whatever. I wonder if you could just provide some examples of what kind of problems these centers were dealing with, and then maybe a little bit about how the various specialists intervene in these specific processes here.
It's a really wide variety of problems, but mainly it says behavioral and educational problems. So for example, if a child could not speak in a certain age, or if they can, it could be like organic problems with the movements and things like that, but it can also be like dyslexia, it can also be like behavioral problem that they cannot fit into the classes, for example, because of aggression. So it's mostly those things that easily visible when a child gets into other institutions such as kindergartens or schools, and therefore mostly teachers and nurses and in many cases families went to these centers and asked for help with these developmental issues. Yeah.
I just wanted to refer to the problem I was talking about yesterday, that psychology show a path on the market. And so it is, from one part, it is strange that there is no enough staff for child guidance clinic, but in the same time, we train a couple of thousands of psychologists every year. But they try to make the market, and there is a big difference between a child guidance clinic which didn't charge anything, and when the mother came with a child and the child doesn't want to go to kindergarten, you could say, "Oh, mother, it's an intermediate thing, will go away." Everything. If you go to private, he or she will propose a long therapy. So this is what I wanted to comment.
I just have a question of clarification for the audience. You see, regarding the mid-80s to mid-90s, at least, or maybe later, beside the child guidance centers that were somehow attached to the local municipalities, there were efforts to introduce a system of school psychologists within the school themselves. And I am a sort of outsider of this field, but I always had the feeling as a Hungarian that there was a hidden rivalry between the two systems. Or how do you see this?
Well, we should go into the dirty details if you want to, but there are huge differences at the moment among the team members, the different professionals, and there is a kind of ethical attachment to, for example, those who remain in child guidance centers and who work there after 40 years and they put a lot of effort and self-sacrifice in it. They don't really like the idea that other people go to not just read to school psychologists, but to live by the market. It's not just a professional question at that moment for them, but an ethical one, and I need more investigation on it. It's also a common narrative that these days the special education paradigm just overgrown the psychological paradigm in there, and there is an inner fight, I don't know, but there are huge differences between these professionals, and I just don't want to speak about it because I'm just not in the position at that moment that I could say anything which is true about that thing. Yeah.
I would like to comment on this. I like your question very much because in Lithuania, as I spoke about those camouflage tactics, now what we have there, the question is, who is real psychologist? Because, you know, we only pretended that we did that vocational guidance, yeah, but we were psychologists, but those who took it seriously, they also said, yeah, but we also were psychologists, yeah, you know. So it is something like that, and it become as contest between departments at the universities who should deliver some particular courses on motivation, for example, on educational psychology and so on.
But through these interviews, it's clear that many professionals could remain in these institutions with this idea in their head that they have their own self-sacrifice, which makes them stronger and makes them morally better, but it's already a kind of psychologization by me, so I don't want to jump to this conclusion at that moment. But thank you.
Thank you very much.